Hi everyone. I'm sorry that I can't be there in person, obviously, but I am honored to be a part of this very important summit focusing on the health of West Virginia mothers, babies, and families. The West Virginia Perinatal Partnership is a great example of the power of collaboration and the success that it can bring when we work together. Your work is crucial to the well-being of West Virginians. We may face challenges when it comes to giving all our children a healthy start in life and making sure their moms are healthy too. And we do face those challenges more than most states, but then so be it. That's the task that we're given. I know that you're working hard to reduce the rates of preterm birth and lower West Virginia's rate of maternal smoking, which is, unfortunately, the highest in the nation. And you are grappling with one of our most overwhelming problems to date, and that is the epidemic of substance and prescription drug abuse that is tragically impacting the very smallest and youngest among us from the beginning of their lives. As many of you have experienced firsthand, far too many babies in West Virginia are born already addicted to substances. What a horrible sentence to have to say. We must do more to increase awareness and stop this from happening. Your organization is doing its part in treating expecting mothers so that their babies will be born drug-free. The treatment centers that you've started and the toolkits for identifying addicted newborns that you issued to hospitals are so important and so necessary for our families. I recently introduced legislation that would curb the abuse and misuse of painkillers, and I'm dedicated to finding ways to do more. I also want to take a moment, frankly, to talk about access to health care. Over half of West Virginia's births are covered by Medicaid. It's about 40% nationally, much higher in West Virginia. We understand that, we know that, we live with that. That's part of our charge and mission. But anyway, it means that many of our fellow state residents cannot afford their own health care. That's what it means, Medicaid. You spend yourself down to the point where you can get Medicaid, and and that'll get you long-term care sometimes, and it has pretty good benefits, and it's under attack here in Congress, and I'm fighting it every single day, fighting to protect it. And so I'm so proud of your partnership's role in working with healthcare providers throughout the state to improve outcomes for mothers and babies through your First Baby Initiative and other projects. We must keep going full speed ahead to improve quality and to lower costs, even as we improve West Virginians' access to health care. Now, that's why I'm glad that Congress passed the Affordable Care Act. A lot of people aren't. I am. I helped write it. I understand what it does. And I understand where its faults are, but I understand where all of its strengths are. And it's going to help countless West Virginia families finally gain access to the affordable health care that they do, in fact, deserve. And it is my hope that it will be the wind at your backs as you continue with your mission to improve the health of our moms and babies. Already, the Affordable Health Care Act has helped West Virginia families with an $88 million investment in home visitation programs that can significantly improve outcomes. Giving health in homes, giving care in homes, giving love in homes can do so much. For example, by reducing preterm births and the need for emergency room visits. It also will expand access to preventive services so that babies and children will have access to needed vaccination, along with vision, hearing, and dental assessments. That wasn't there before. It is now. It is the law. And now mothers will have better access to breastfeeding resources and counseling services to help them quit smoking and to avoid alcohol use. All of these and other provisions in the health reform law can help improve pregnancy outcomes and give children a healthier start in life. Finally, I'm so proud to support initiatives like your Connect to Care program, which connects rural clinics and hospitals to help improve care for pregnant women facing high-risk pregnancies. In 2007, the only board-certified obstetric specialists in West Virginia were located in Charleston, Huntington, and Morgantown. Women and babies needing the services of high-risk specialists often had to travel long distances for care, and many missed their appointments because of the long distances on difficult West Virginia roads, or simply because they couldn't afford the gasoline, or for a whole host of other very human reasons. The Connect to Care project is now helping more expectant mothers to receive the care that they need from almost anywhere in the state. That's why it's so valuable. Now, of course, there's a lot left to do, and nobody knows that better than you. But it's unquestionable that West Virginia and our state's very youngest citizens are better off thanks to your dedication and to your hard work every single day. It matters tremendously, and I hope you know that. I think you do, but you needed to be reminded of that and praised for that. And please know that I stand with you every day in your efforts to improve care for West Virginia's mothers and babies. Thank you very much.